Week we told you about an outbreak of pertussis, commonly known as whooping cough. It hit Allegheny County. It sent 26 people, mostly teens, to the hospital. In California, 10,000 came down with that illness. So why the sudden outbreak here? Health officials say it's because the vaccine that's been used since the 90s isn't as effective as the one originally created in Grand Rapids in 1947. This news comes a week after the CDC warned that the flu vaccine being used this year also isn't quite as effective as it has been in previous years. So, I'm joined this morning by Mary Wozinski, the immunization program supervisor for the Kent County Health Department. So, thanks for coming in to talk about this. Let's start with that whole pertussis vaccine deal here. It's not as effective now as the one that was used years prior. Why did they change the formula if it's not going to be as effective?
Well, we didn't know it wasn't going to be as effective. And with the whole cell vaccine, there were some side effects. High fevers, inconsolable crying, some seizures. And so the manufacturers are always looking to make vaccines safer. So they took the whole cell and chopped it up and made it acellular. The side effects decreased. The vaccine was safer. Now we're seeing with the studies that are done that the immunity is not lasting as long. It wanes over time. That's one piece of why we're seeing the increase in cases. The second piece, I believe, is because vaccines, we're a victim of our own success. We've done a great job, so people aren't vaccinating their children. Many of the outbreaks in California occurred among clusters of people who were not vaccinated.
Aren't using the vaccine.
They're not using the vaccine. So it's sort of a combination of both. And pertussis as a disease is cyclical. It sort of peaks every 3 to 5 years. So when you put all those combinations together, it makes for an increase in disease.
Okay, not using the vaccine is a personal choice here, but if you did get immunized and now you're worried about that, what do you need to do here? I mean, do you have to worry about your kids? Is there a certain age gap, you know, because the vaccine earlier was more effective? Is there a cutoff point that you should be worried about getting this vaccine? How should we be
all
doing
adults, if you've never had a dose, you should get a dose immediately. Even if you had a tetanus booster in the recent past, there's no interval. You can get a dose of the tetanus vaccine that has the whooping cough in it. It's an inactivated vaccine, so the way our immune system works, it takes several doses to be effective. So who's vulnerable? Our babies. Those are the kids that can get sick, and we've even had babies die from pertussis.
Yeah, certainly. This is not a joke here.
No, it's not.
But it seems to be one of those kind of old world diseases, really. You know, the one that we really haven't talked about in years.
Exactly. We need to tell our story. We need to tell people that it is a very serious disease. And what happens is you can get a secondary bacterial infection, and that's what people end up dying from.
Okay, real quick here, what would be a sign that my child or somebody that I know has whooping cough?
Well, it starts out just like a cold. You know, you have a runny nose, maybe a sore throat, a low-grade fever. So it's sort of nonspecific, but then you start coughing, and you can't stop coughing.
And that's a good time to go to see the doctor, huh?
Exactly.
All right, we appreciate your coming in here. Thank you so much for your time. Emily?